Healthier individuals are generally more productive. People in good health are more active in the workforce. Good health can encourage investment in education, in your own education, encouraging growth. And healthy individuals are more likely to invest in long-term projects, like small businesses, anticipating that they will benefit from the future rewards. Now, we were able to bring together a lot of evidence to support these arguments. For instance, better health is associated with increased hourly wages. Poor health is associated with working fewer hours per week or retiring early. Chronic illnesses and disabilities can reduce one's employment probability, and adolescents in poor health are less able to benefit from education. So there's a huge amount of research that indicates that health investments, alongside those in education and in digital and physical infrastructure, significantly drive economic growth across nations at all levels of development.
We know from evidence from the TILDA study, for example, that not only are people who are in poor health less likely to work, so they retire early, and obviously for their own well-being that's a poor outcome, obviously for society at large. But they also are less likely to participate in other sort of activities that are less monetised, but are equally and really important to society. So things like caring. They're less likely to care for spouses, they're less likely to care for other people in their community, for grandchildren, for example. And that's a huge contribution that older people potentially make to society. And finally, as well, they're less likely to engage in other activities like volunteering. We know that people in poor health are less likely to volunteer, and again, that's a huge contribution to society that tends to be not monetised, but I think reinforces this point around the importance of investments in health.
First of all, there's that reactive health service, which is when people get sick, when people are unwell, and we need to have a service that is there to be able to deal with them. But then we also have that proactive health service, which should be about trying to offer advice and guidance to the population to enable them to stay well. I suppose the difficulty is that we seem to have governments that focus just on the reactive health service, that it's about providing those health services for people when they get sick, and there's not just as much emphasis on trying to advise and help and shape communities to enable people to stay better.
I suppose my response is in the context of working in social inclusion, anti-poverty and local development. And in answer to your question, like what can ordinary people do when their needs are being ignored, I think find your extraordinary. There's many extraordinary people living in communities, and I would say that what you do is you get political, you get informed, get organised and get local. So we're a firm believer in the local development network that no matter what the national policy might be or the intention, that responses are best when they're locally based.
Yeah, I think public health should trump commercial interests. I think that has to be our starting point. There has been some measures that were brought in the South that weren't extremely popular. The minimum unit pricing of alcohol being one, we supported it, even though from some quarters it was seen as unpopular. And so I think that comes down to political will and being brave enough to make those decisions. And we saw it with tobacco use and the moves that were made across the state and Ireland, across the world. Ireland was a leader in that. So my approach to it philosophically and politically would be public health always has to trump commercial interests. And where commercial interests push back against public health has to win.
And we need to look at how we're spending our money now and ensure that we are sharing resources much better. And that includes the resources that are being distributed at the local level and the national level as well. And I'm sure it's not about, it could be about savings. It most definitely will be effective and more efficient if we did that. So we have to look at the budgets differently. And I think we can learn some lessons from how we all had to act during the COVID period, where we collapsed the hierarchies, where we stopped thinking about the strategists, the decision makers, the implementers, and we were all in it together. We planned together, and in planning together and innovating together, I think you can make a real difference and a real change. And I think that we do have an opportunity to do that.